The African American Legend series highlights the accomplishments of blacks in areas as varied as politics, sports, aviation, business, literature, religion, and health. We will explore the accomplishments of African Americans who have been previously excluded because of segregation, racism, and lack of opportunity, and yet have risen to be strong people in each one of these fields. I'm your host, Dr. Roscoe C. Brown, Jr., and with us today is Debra Fraser-Howze, the CEO of the National Black Leadership Commission on AIDS, which she founded and led and has done a tremendous job. Glad to have you with us again,
With your help.
Debra.
Thank you, Dr. Brown. It's a pleasure to be here.
Well, you know, when we started Black, we call it, some years ago.
15 years ago, 2002 will be our 15th anniversary.
That's really great.
Yeah.
I remember that.
Yeah.
AIDS and the HIV/AIDS in the black community wasn't as rampant as it is now. It wasn't even recognized except as a nascent problem.
Right.
What's the status of HIV/AIDS in the African American community in the year 2002?
Where we've come in the last 15 years and in the last 20 years of AIDS in general is really phenomenal. When this epidemic first started, it was called GRID, the Gay-Related Immune Deficiency Disease, and came about with the discovery of about 5 men in San Francisco and other parts of California who gone to hospitals and died from some strange pneumonia. Today, we have lost more people to HIV and AIDS than we have lost in the Vietnam, Korean, and the Gulf War combined. We are in a state of emergency in the African American and Latino community in all of the major urban areas, but particularly in the African American community, where we now consist of 56% of all new infections in the United States of America. We still have the highest rates of death from chronic illnesses, higher than all other minorities combined, and this is prior to the HIV/AIDS epidemic. We have an infection rate that rivals none. We far surpass the white community in our numbers and far surpass the Latino community
But
in our
what's
numbers.
happened in this period of time has been sort of a flip-flop. In the white gay community, because of safe sex and other procedures,
Right.
that rate has dropped tremendously. But in the African American community and the Latino community, because of intravenous drug use
Right.
and
Right.
unprotected sex, it has gone up. So
Right.
you have one going down and one going up. And that relates to the question of the resources. Have the resources been equally distributed in terms of the needs?
Very good question. The resources have not followed the course of the epidemic. And under most circumstances, those kinds of things would be seen as just plain discriminatory and something that African Americans and Latinos generally have to deal with on a day-to-day basis, just general racial discrimination. However, when it's in public health and it deals with the actual survival or death of a human being and a race of people, and then it becomes an atrocious situation, which is what we have now. There is no other public health sort of epidemic that rivals HIV and AIDS, and has not in our lifetime.
And that's true not only in the United States, but it's true in Africa and it's true in China, which raises the question, maybe you might want to bring our audience up on this. What is the mode of transmission of AIDS and why is it so insidious?
The mode of transmission as we know it is the same that it has been when they discovered and the actual virus and gave it a name of HIV. You can transmit AIDS in utero, so from mother to child it can be transmitted. We know now that you can transmit AIDS, the virus itself, the HIV virus, through breastfeeding, breast milk, which is something that in the last 10 years has become something that's prevalent, particularly for the third world countries, and that kind of discussion about how babies are getting infected. They're born non-infected and then becoming infected because their mothers are giving them breast milk that is infected. We know that you get it through the exchange of bodily fluids, and that is particularly with blood. So the sharing of needles is absolutely out of the question. And we get it from unsafe sex. The epidemic in America...
But you don't get it from talking to people with AIDS,
no.
Hugging people with AIDS, eating with
eating
people.
behind people with AIDS.
You don't get it. And those are some of the stereotypes that came out early on.
Right.
I know when I was president of Bronx Community College, there were a couple of students who had HIV positive, and people wouldn't sit and eat with them. So
Well,
we had to do an educational activity
Absolutely.
to help them to understand the particular nature
Right.
of this disease,
Right.
which then leads us into prevention.
Right. Well, you still have a situation where people are still concerned about sitting next to people with AIDS and eating around people with AIDS. But the reality of that is that the people with AIDS have the compromised immune system, and they are more vulnerable to death because you have a cold than you could ever be because they have a virus. And once people begin to understand that, then it becomes clear going to prevention, and why now the African American community and Latino community, as opposed to what happened in the very early parts of the first wave of the epidemic, I like to call it, with the white gay community. Everything that we know points to the fact that black people were always infected with HIV. We were infected in 1980 when they called this thing GRID. We had women infected, we had children infected. But the focus on prevention methods was not in the African American community. It focused on who was presenting with the disease. These are the people who had resources. They went to doctors. The doctors were following all of these symptoms, and when they got the pneumonia, they went in with the pneumonia and they found out that there was something strange going on some 20 years ago. The other individuals who were always with them, many of them died not knowing that they were ever HIV positive. So when you look at the epidemic where it is now and the outrageous rate of infection that has gone on in the black community, you can't have an infection rate at that level without having a continuum of disease. So we've had this disease all this time. The question is, when did people begin to focus on the fact that we had this disease? When we knew that we had a heterosexual epidemic in Africa, when we knew that 80% of the world's epidemic was heterosexual, it's not male-to-male sex transmission, but heterosexual. We should have looked then at those communities that were resemblance in third world communities around their health status in the United States and said, we need to watch these communities because there may be a heterosexual type epidemic going on here. That does not exclude the fact that we have a number of gay brothers, black men, who one recent study from the Centers for Disease Control with a control group of black men showed that the infection rate was 1 in 3. We have that's a catastrophe.
That is.
That's worse than some areas in sub-Saharan Africa.
Now, with this treating HIV/AIDS, a whole range of so-called miracle drugs, retrovirus drugs,
protease
and so on.
inhibitors, yeah.
Now, how have those drugs been used in the African American community, and how effective have they been?
Well, you have to look at first who had access to the drugs first, and those were the people who were in the clinical trials. Those were the people who had been going to the doctors. Those were the people who had been focused on in the first wave of the epidemic. So we've got a long-term epidemic with no treatment, no knowledge base, no nothing, actual benign neglect, which is what was going on. When you look at those people in the first wave of the epidemic, they had access to all of these kinds of treatments. And when we finally broke, when David Ho, the doctor who really invented sort of, for lack of a better term, the protease inhibitors, came up with this collection of medicine that seemed to work in many of the patients, it got a broader and broader and broader reception. And then it became AZT with DDI, and that's what they call this protease inhibitors, this combination therapy. Because you have to have a doctor who knows you well enough, knows your health well enough to say, all right, I'm going to give you medication 1, and then I'm going to put medication 2 and 3 next to it and see if that works for you. If that doesn't work for you, maybe we'll try medication 1 and 5, and let's see that. This is a long-term process. And in this long-term process, we found that it's been very effective. People have become healthy, they've rebounded, their T cells have risen again, and they're back in full health.
Well, that's interesting, but in order to continue that, they have to continue the medication.
Medication sometimes is 40 pills a day.
Very, very expensive.
$40,000 a year. Sometimes,
well, who's going to afford that?
Right. Some almost impossible for some, where we are getting free medicines, like programs like ADAPT. We have programs with the state and federal government that do allow for free medicine, by the way, that Black had fought for. You all fought for valiantly and got this money so that they could give medicine to people who could not afford the medication. And you still have a problem with people getting the information about even those programs. And you still, that's why shows like this are so important. You still have people having a concern in our community about taking the medicine, period. There is a real fear because the public health system in America has not been kind to us. The public health system in America gave us a syphilis experiment, you know, and we talk about that all the time. They call it Tuskegee, but it wasn't Tuskegee. You know, even it's even a misnomer. It was actually, and I'm talking to you about Tuskegee. You know about that term better than ever. You know about that term better than anybody else, which is my sensitivity to term is, why do we keep naming it Tuskegee? Because it happened in that portion of the country. It should be called the CDC study, because that's who carried the study on without treating these Black men for 4 generations of syphilis and letting them migrate, by the way, from the South to the North, something that didn't stop until 1972 when Senator Kennedy asked for a congressional hearing and asked for them to stop the experiment. This has been from the 1940s to 1972. Do you know how many people in the Black community have been infected with syphilis because of something that was so absolutely outrageous? But there's, you know, there's a milk company that came out to certain parts of Africa and gave women formula, and when their breast milk dried up, they left, so the babies died. You've got situations where you've had smallpox in blankets. You have documented part of our public health history where people of color have been sort of bombarded with negatives by the public health system. So you've got a situation that is real, and then you have slavery. Then you have a community who's looking at their own survival and not trusting a lot of people who are now in authority and in control of our health. Then you say to them, I know I didn't tell you 10 years ago you had this disease, but you do have this disease, and the way to stay alive is to take these 40 pills at $40,000 a year. Then you've got a little bit of a problem in getting that kind of information over to people.
Well, you've been very good with this. The communication you've just given us is excellent. Going back 15 years ago, you and some other folks out of the Urban League and some of us in the African American community created the Black Leadership Commission on AIDS. What was the purpose of that commission, and how has it developed in those 15 years?
40 leaders from the African American community. We pulled them together and took them to the reverends that were there. We'd like to call it Reverend Daughtry, Reverend Timothy Mitchell, a wooded place. We went someplace secluded. We had signs up that said, drop your egos here, with little garbage cans. We worked. We broke into groups. We had David Dinkins, who was then the borough president of the city of New York, then later to become the mayor of the city of New York, borough president of Manhattan, mayor of the city of New York, now the chairman of the board of the National Black Leadership Commission on AIDS. You had people like Bill Lynch. You had Hazel Dukes. You had people that were from, you had ministers and clergy from all over this city. You had somebody from every borough, and we broke them up, 40 of them, and we said, we have a problem, and we want you to come up with some strategies on how to reduce the spread of AIDS in the community. Many of you all said, oh, Deborah, that's not, here we are, we're politicians, we're public policy experts, we're medical doctors. You got a group of medical doctors here, Dr. Benny Prim, all of them, Dr. Larry Brown was there. You asked them, and I said, no, what we need you to do is somebody like Al Van. We voted for you for 30 years in Brooklyn. How do you get us to do that? And I want you to take that vehicle that you used to get us to vote for you for 30 years and let us send an AIDS message through it. Roscoe Brown, Tuskegee Airmen, a magnificent figure in our history. You have your own university. You over there at Bronx Community College. You have to manage this every day. When you want to send a message out to the students of Bronx Community College, What are the vehicles you use to send that message? Can we look at those vehicles? You help us study those vehicles, take them apart, and let's send an AIDS message through the vehicles. And in addition to that, since we've got all 40 of you together, we got a crisis where they're really not paying us any attention. They're not giving us any medicine. They're not giving us any money to deal with this problem. Can we have an advocacy unit that to move with that? The commission was built on the concept of the Council of Elders. It is as African as this show in African American Legends. There was a time of crisis in the African community where the elders sat down and looked at the problem and tried to come up with solutions so that the young people could go and live their lives while the elders took on the burden for the community. And that's what BLACA is.
Now this, we call it BLACA, Black Leadership Commission on AIDS, is now a national organization. Yes. Could you tell us a little about how it expanded and where it is and what BLACA National is doing?
Well, with the help of my board, you included, and especially, and Chairman Dinkins, and we have Reverend Calvin Butts, and Dr. James Dumpson, and Dr. Megan McLaughlin, and all of the people who've been around to help in the shaping and molding Dr. Benny Prim of BLACA as an organization. We've had 60-something members of the Black Leadership Commission on AIDS that are still a part of the heart and soul with the agency. It is in looking at beginning and the technical assistance needs of the Black community. What do we need to teach people? How do we need to help people get the information? How do we need to build up the churches so they can actually run programs that took care of people with AIDS? What happens when somebody gets sick and goes into a church, a mother, and says, my son is dying and I don't know what to do, Pastor? Has the pastor been trained in any way to talk about this as an issue? Looking at all of those kinds of things and putting all of those kinds of programs together, we were approached both by the state and the federal government, who said, you know, we don't have anything quite like you anywhere else, where another level of leadership is involved. And what we've seen is that when you put together not just the leadership in the community-based organization, but those leaders who are indigenous to the communities, who have a history and tradition of service to their people, who people trust, that's what BLACA is. It's the leaders that people trust. We have such extremes from the conservative to the radical that if you really don't like somebody on the commission, there's somebody on the commission that you do like. It's the idea that everybody has value. Everybody brings value to the table when you are among the elders and you have shown that you respect and love your community and that you have access and resources, you bring value. So it is that value that has propelled BLACA from an organization that took 40 people away one day to one that now is expanding to opening offices in 17 cities across the United States of America.
Now, how is this funded?
Well, we do receive funding from the Centers for Disease Control. We receive funding also from the state of New York. We also receive funding from the Ford Foundation. Our goal is to self-monitor our programs, to ensure that we have a self-evaluation system in place, because it's very hard to judge if you're successful in prevention in the Black community. It's almost impossible. You first have to study the Black community like you would any other science. And you have to be committed to studying the Black community outside of those who study us for marketing purposes that would sell us alcohol and cigarettes, but using that same basic level of science of study, which is a real study, and study us to see what makes us tick. How do you get into our communities? How do you speak to us to make us change behavior? What is blocking those changes in behavior? Who are the change agents in the community and who are the gatekeepers in the community? How do we get to the children? And once those studies are done, and BLACA is that study within itself, because these are the leaders of the community. Once that is done, then you shape those messages and begin to get them into the community.
And then there have been other groups like the Ministers, the Balm and Gilead, and several other groups that have begun to pick up on this.
Oh, absolutely.
So much so that you brought them together in a national Millennium Summit on AIDS in Atlanta, Georgia, sometime in 2001. What came out of that summit?
Well, of course, as I said, June 5th and 6th, I believe, marked the 20th anniversary of AIDS in America. We decided at that point, particularly where the numbers are with the African American community, was to bring the leadership together. Some of our highest leaders, we had Coretta Scott King there, we had Dr. Sullivan, we had the heads of the NAACP Legal Defense Fund, the head of the Black Agent, we had members of the commission. We brought people together from all over, deputy mayors, the mayor of Atlanta, people with Chairman Dinkins, all into one place in one hotel in Atlanta, and we said, here we are, it's 20 years later. If you look at what we've all done, different programs, different people, collectively, we are still not where we're supposed to be. How do we come together and develop a plan, one, of recommendations for the new President of the United States, George W. Bush, two, and most importantly, even more importantly, what is the recommendation that we go home with to our own leadership in our own communities? And we developed an active plan that looked at business in the Black community, that looked at healthcare in the Black community, that looked at even the young entertainment world in Hollywood. How do we get every part of us together to make a difference so that the next 20 years doesn't see us still with AIDS and doesn't see us sort of still behind the 8 ball? Why should we still be in the situation we're in now when in this epidemic, another community in the first wave of the epidemic who had their famous people who have come out, who have helped them, who have their communities, and they're to be commended for what they did. Why are we still where we are? We examined that, we tore it apart, and we came up with the solution for it, and that's what we're moving forward now in all of the Blackists with all of the organizations together.
Well, the epitome of this will occur with National Black AIDS Awareness Day on February 7th,
right. Okay.
2002.
Right.
What are you going to do on National Black AIDS Awareness Day?
Well, we're going to have activities going on in 17 cities around the country. All the cities where we're going to have activities are going to be cities that Blacka has targeted for the openings of their affiliates. Where we have our affiliates opening in Atlanta, Baltimore, Detroit, Newark, where we have those affiliates, and all across the state, our Blackists will be involved in sort of a statewide, nationwide call to action, explaining to the communities in press conferences where we are and why we are here and what we need to do to get out. And we'll also be announcing the plan that came out of the Millennium meeting. We're doing this also with some other partners from around the country. The National Association of Black Alcoholism and Drug Abuse, Health Watch here in New York, an organization that focuses on gay men of African, concerned Black men, gay men of African descent. We are doing this with these organizations as our partners, as we also have partners in the Latino community. You know, BLACA is the model on which the Latino Commission on AIDS was born, the Native American Commission on AIDS was born, and we've done a lot of work around helping to shape the beginning formings of the Asian and Pacific Islanders Commission on AIDS. So we have been the model, and we're hoping that this will allow us to remain a catalyst for change and action across the United States.
What about the media? Are you going to do media saturation?
Right. Every city will have
entertainers and music and commentary? Every
city will have a press conference, but in every city there's also going to be one main activity. And in the city of New York, where BLACA is nationally headquartered, our main activity will be a hearing. We're going to have hearings with public officials, people from Congress, people from the city council. We have a new mayor. We want to be involved in our hearings so that we can speak on where we are in the epidemic. We think it's a day that we should also use to inform the leadership, not just the leadership of the Black community, but the leadership for all the community, particularly the political leadership in the city and the state, to understand that as we move forward, we are moving forward as a community in crisis and a community that's in a state of emergency.
Now, you say we're in a crisis, and I agree, but a crisis has to end. What is your end point? What do you think will happen as a result of these activities over the next 5 or 10 years? Will the rate go down? Will there be fewer AIDS orphans? Will there be more people staying alive? What's your projection on that?
There's a good projection, and there's a bad projection, but both of them are real. The bad projection is that we're going to die. There's no question about it. There's going to be massive death in the African American community as a result of HIV and AIDS, and death from other chronic illnesses. We're going to get sicker and sicker. We're going to get weaker and weaker.
Can't we stop that now?
And we can control the information that's going to the next generation so they don't find themselves in the position that we find ourselves in now. And I'm saying the next generation, I'm hoping that my generation can control it now. And this is my generation to the younger generation is the generation that's stuck in the middle of the AIDS epidemic. There is still another generation that is coming up that we've got to save. So we've got to focus on them, and that's the way around that. That's the good news. The good news is that we do know how not to get AIDS. And we need to stress that. We need to make it clear that people are growing up now in a new kind of sexual revolution. We need to make them safe and not sorry. We need to make our young people understand the importance of choosing life. Because the reality is, for the generation of people that are from their very late 30s to their early 50s and into their 60s, we're in crisis. And we might not be here in the numbers in which we should have expected to be here in the new millennium, the 21st century, going into our 60th and 70th year of life.
But doesn't this say something about our attitude towards sex in our community? You know, whole business of safe sex, responsible sex, no teenage pregnancy. So
it says
this
everything.
seems to be relate to a lot of things in the overall mosaic of the African community.
You know, we're not a bad people. We're a very private people, a very proud people, a very conservative people. People with, you know, people who have been discriminated against for a long period of time, even after a while, begin to believe themselves that there's something wrong with them. There's nothing wrong with us. We've just been very conservative. That conservativeness is now not to our advantage because we're not talking to our children. We're not saying what we need to say. And I'm in such crisis mode at this point, Roscoe. If you can't say it to your child, if you can't say it to your grandchild, let somebody else say it. Somebody's got to say it, or that kid's not going to be around.
And thank you for saying it to us on African American Legends Today.
And thank you for
Debra
having me.
Fraser-Howze, CEO of the National Black Leadership Commission on AIDS. Thanks for being with us.
Thank you. Thank you so much.